Can you give me a list, and whoever wants to jump in or hand this off, can you give me a list of the top 5 or top 7 or top 3 peptides that fit into the category of these are great for women?
So I'll start and then let these guys chime in. I think all of us, feel like you have to have the growth hormone secretagogues on board. So they're probably the maybe number one, because we know that we want to replace everything we lose as we age. So you've got to replace the hormones. In fact, that's probably paramount. And none of us would probably go to peptides as our first choice with women. We're going to actually optimize their hormones first, even in our young women, right? Even young women tend to be low testosterone, especially if you've been on birth control pills, things like that. So you've got to make sure the hormones are in place. And I'll let Erika talk a little bit about that too. But since that's really, she's written books and books about it. And then you've got to replace the other things you lose, which is growth hormone. So it produces what's called IGF, or insulin-like growth factor. So you have to replace that. And so all of us we'll use different things, but CJC and ipamorelin, which are what's called a growth hormone releasing hormone and a growth hormone releasing peptide. So those two together cause your pituitary to release more growth hormone. And you can use those to help sleep. You can use them to help build muscle, but in general, they help everything. So that's going to be sort of our first go-to. And then I think, for me, one of the things I have almost all my patients on is something called thymosin alpha 1. And that's because if you look at the other thing that happens to us as we age, or I won't even say age, because I really don't like to think of everything we do just in the 50-year-old women. This is something that 20 and 30-year-old women should be thinking about too, but we have to restore immune function, because immune health also affects muscles and everything else. So we all use a lot of thymosin alpha 1, which is a thymic peptide that helps to restore immune health. And especially now in COVID world, I think it's a really important piece. So those are the two that kind of come to mind to me. How about you guys? What else?
Betsy, I'm going to always add a repair piece and I might even start with the other one. I think I've talked before on this show with you, Carl, when I've talked about my inflammatory patients that have other autoimmune diseases. I'm gonna probably start with the immune modulators, and then I'll add the growth hormone secretagogues next. And obviously, everyone is different. It really depends on the patient. But I'm going to probably add something for repair, because if I'm starting out with you and asking you to make changes in your diet, and I'm asking you to begin exercising and be active, then you're almost assuredly going to have some sort of injury. Just it is what it is if you're active. And so and helping your muscles in general to repair from everything we do on a regular basis, but especially if you're doing some resistance training, I want those muscles to be able to go back to go exercise again the next day. So there's a couple that I think of just off the top of my head would probably be BPC and TB4. They can come together. They can come separately. They are also particularly important. There's lots of research with the BPC on intestinal health, and that's such an important part of everyone's recovery from lots of illnesses. Someone I think mentioned a concern about insulin resistance. All of these are things that will help with your intestinal health, and so that's why we would choose to add on a repair peptide like the two of those.
Yeah, I do exactly the same thing. And the interesting thing I find is that the limiting factor in our practice is the number of shots that people are willing to give themselves. So as we were saying, I start out with oral. So BPC happens to be oral, and it covers two things, immune boosting and anti-inflammatory. So it's the third peptide I use, CJC, ipamorelin being the first one, second at the same time, thymosin alpha, and then I use TB4 more in recovery post-surgical and people who have orthopedic surgery before and after, or plastic surgery, whatever they have surgery. Anyway, the thing is that as I said, the limiting factor is my patients will say, I don't want any shots. So that's when I have to step back. And I mean, I start out historically, I've been practicing hormone. I've been doing bioidentical hormones for 26 years and kind of started the movement. And so everybody comes to me for hormones. So the hormones, thank God, are either oral or transdermal. So it's easy to start with them, and then try to give it to them orally and talk them into the fact that they're going to feel better. And like 6 weeks into CJC-IPA, all of a sudden I have a very different audience. So I do exactly the same thing.